My name is Chris Atkins. I have been wearing glasses up until April for 32 and a half years. When I was 7 years old, I started having vision problems, and the doctor that I was taken to classified part of my problem as a lazy eye. What that actually ended up being was astigmatism. Through most of my life, I've been chained to these glasses, okay, in anything that I've done. I played 4 sports. I had to deal with wearing rec specs, contacts, everything else, okay, and it always got in the way, okay? And everything I've done, it got in the way. And I wished I could get rid of my glasses. And I'd always been looking toward LASIK for a while, but one thing I've always been careful of with my eyes is you've got 5 senses, okay, and you use all of them, okay, but in difference to the other 4, the one you're going to use first is your eyes. Okay. Now, if you lose your eyes, you can use the other 4. The other 4 will step in. But all things being equal and all 5 are there, your sight is the most important thing. So I'd always been real careful about how I move forward, because I got other people depending on me than myself, and I'm not going to be good to anybody if I'm blind. So when I started looking at where I was going to go to have my eyes worked on, I wanted to make sure it was the best, and I didn't want to pay an arm and a leg, but I wanted to make sure that I was paying for the best. And I did my research, and Dr. Wang was the best choice for me. Okay. Other people had talked about other doctors, but when I looked at his credentials, that was the best for me. I was a little bit apprehensive when I came in, but he examined my eyes, and when he examined my astigmatism, he didn't just take 1 or 2 readings, he took many readings. Both the first time I was here and when I came in for my surgery, he retook those again. And that meant a whole lot to me. He took his time and he made sure that he was customizing what I needed for my particular case to me. PRK was needed for me because of my astigmatism. After the surgery, I was able to see. It was a little bit blurry, as you'd expect, okay? But I was able to see very well. I didn't need my glasses as soon as I got off the table. Okay? And the night of my surgery, just as a previous speaker said, Dr. Wang called me that night to ask me how I was doing and if I was having any problems. Okay? So that tells me that he is a conscientious doctor that doesn't shut down his office in his mind after 5 o'clock. Okay. So that spoke a lot to me. And over the weeks that have followed, I am now, after having my surgery at the end of April, I'm seeing 20/15 in both eyes. Okay. I can see better now than I did with my glasses. Okay. I can see things that I never even could see with my glasses before. Okay. Which makes it even more for myself. I'm an engineer and a building and codes director for a local county. I do get out with contractors, but before that I was a contractor and I worked heavy machinery and operated every kind of piece of equipment you can think of, okay, in addition to engineering. Okay. So I was in a dirt environment, which is not conducive to wearing contacts. So basically, to live in that environment, you just have to wear glasses. Okay. And after this surgery, I don't need the glasses anymore. I can go into any environment and it doesn't bother me. And when it comes to the environments my eyes was exposed to after surgery, even though I'm not in construction anymore per se, me and my father raise cattle and we raise hay. Okay? And because of that, I'm in dust and sweat and oil and grease and anything else that would be classified as deleterious to your eyes. Okay? Now, of course, I take safety precautions, wear my sunglasses and whatnot. What I'm saying is that if this procedure could do as well as it did for me in the environment my eyes are exposed to, you have at least as good of a chance of having great eyesight as I did and do. So, that's all I have to say. Thank you.
Thank you.